You're listening to Dispatch Radio, sponsored by theGlobalDispatch.com.
Okay, well, welcome back to the show. On the east coast of Florida, we have a tropical disease that has appeared, and it's causing some concern. It's been confirmed in 3 different counties, and the disease is called dengue fever, which isn't normally seen in the United States. Joining us now on the phone to discuss it further is Bob Washam. He is the Director of the Environmental Health for the Florida Department of Health in Martin County, Florida. Bob, are you there?
Yes.
Hi, Bob. Welcome to the show.
Thank you.
Okay. Well, some more events happened since the booking when I booked you yesterday morning. I see your county has 3 more confirmed cases, and there's a confirmed case down in Miami-Dade.
Yes.
Yeah.
Yes. Right now we have 7 cases of dengue fever that have been confirmed that are all locally acquired here in Martin County.
Yeah. So why don't we start out by telling our Tampa Bay area audience and our internet audience what's the situation in Martin and St. Lucie County?
Well, right now it's really focused in Martin County. Some of the cases actually live in St. Lucie County, but they were exposed to the mosquitoes here.
Okay.
And what has happened is that people have been bitten by mosquitoes and come down with this disease.
Okay, and can you comment on the condition of any of these patients? Do you know any?
All 7 people are either recovered or in the process of recovering from their illness.
Okay, very good. And I understand this is from the Jensen Beach area. Can you describe what that is?
Martin County is on the East Coast, on the Atlantic coast, between Palm Beach and Fort Pierce, and this location is a neighborhood, mostly a single-family neighborhood, and it is along the St. Lucie River.
All right, perfect. And Florida and other states in the United States see dengue fever sporadically, but however, it's usually due to international travel. None of these people have traveled overseas, so they're considered locally acquired. How does this affect your health department? Is it anything special because it's in the mosquito population?
Well, for us, we are spending a lot of effort on this because it is very rare in the United States. These are up until the cases in Miami-Dade County yesterday. These are the first cases in the United States this year.
Right.
So we are putting a lot of effort to try to control the situation. And the first things that we did were we had mosquito control go out door to door and eliminate any standing water because that's where these mosquitoes breed, and especially in containers.
Right. And as far as actually testing the mosquitoes themselves for the virus, have you had any success with that?
We have not done that yet, and that's very difficult. Right now we're really putting our efforts in trying to find people that have symptoms and having them tested, and also notifying the residents to avoid mosquito bites. Okay.
And there's a program that health and mosquito control departments do. It's called the Sentinel Chicken Program, and that's typically used for detecting stuff like West Nile virus and other encephalotides. Is the Sentinel Chicken program useful for detecting dengue?
And the Sentinel Chicken flocks are set up more for detecting other mosquito-borne diseases such as West Nile, St. Louis encephalitis, and a couple other mosquito-borne diseases.
I'm sorry. Go ahead, Bob.
So right now, none of our chicken flocks, we have 7 chicken flocks, and none of them have tested positive for any mosquito-borne diseases. And also, these cases seem to be very isolated into one particular part of our county, and it's really almost everyone has been exposed in a very small area.
Yeah. So essentially, there was no early warning system for detecting this dengue.
No, there's not any early warning. The early warning we got when we started seeing the people with these symptoms.
Okay. So what actions has your environmental health department taken so far and need to take in the future to get this under control and prevent further spread?
Well, like I said, we did work with mosquito control originally, and they went out to at least 800 houses door to door. We also provided information to the residents on how to eliminate the spread of the disease, the spread of the mosquitoes. We've also notified the medical community to be on the lookout for symptoms with their patients.
Okay, and as an environmental health guy, what recommendations would you have for our listeners for the prevention of any mosquito-borne disease?
Well, mosquito-borne diseases, especially in South Florida, we have the type of mosquitoes that can transmit not only dengue but also West Nile and St. Louis encephalitis. So the best thing for people to do is to avoid mosquito bites, because that's the only way that you can get those diseases. And what we recommend is people to cover their skin with clothing or repellent if they are in areas where there are mosquitoes present.
Okay, great. All right, Bob. Well, good luck with your work down there in Martin County, and hopefully things work out for you, and keep up the good work. I appreciate you coming on the show.
Okay, thank you.
Thanks, Bob.
Bye.
Okay.
Bob, I just wanted to say, this, folks, is why I'm so proud of the Global Dispatch and what Bob does with his years and years of infectious disease and microbiology experience, because we talk about this stuff. We're going to continue to bring on experts, and sometimes the cases are not right here in our backyard, and our internet presence really kind of takes us to those particular neighborhoods. But here we have something that Bob has covered, I don't know how many hundreds of times, and here it is right a few counties away. So kudos to Bob. I love you for it, brother, and just, proud to be in this with you, because what a great job you're doing.
Yeah, and always try to keep it timely.
All right, so are we ready to move on to politics?